My name is Val Horton. This is going to be my skills video for intradermal, intramuscular, and subcutaneous injections. Okay. So for the first one, I am going to start with IM, so intramuscular. I confirmed the doctor's orders. Have gathered my supplies, and pulled up, got my medication, did the 9 rights of medication. This is the right medication for this patient. In this case, we are going to be giving this patient an IM injection of an antibiotic. I'm going to be using his deltoid muscle and not be giving him more than 1 milliliter. So I confirmed the dosage and all of that. And all the 9 rights of medication. So for that, I'm going to use a 3 milliliter syringe. Here it is. And I'm going to drop 1 milliliter. Of this antibiotic. Alright. I'm going to go ahead and switch this out, dispose of this into my sharps. Switch this out with my other one that I'm going to use to inject the patient. Okay, now that I have all my stuff, I'm going to go ahead and hand hygiene, and then put on my gloves, introduce myself to the patient, let the patient, confirm the patient with name and date of birth, confirm that he has no allergies, and then, do all my 9 rights of medication again, and explain to the patient what we'll be doing. So, patient is ready to go. So this is his deltoid muscle. I'm positioning myself in a good position, cleaning it. I'm going to let that dry. All right. And here I have my stuff. Okay, so I'm going to go ahead and insert this at a 90-degree angle. Okay. Inject the medication. Wait about 10 seconds. Remove. Safety's on. Dispose of this into a biohazard, the sharps container. Okay, there's a drop of blood. I can go ahead and tap that, but I'm not going to rub it or anything like that. So after that, I'm going to dispose of my supplies, my gloves, do all my safety checks for the patient, and then go back and do my, hand hygiene, go back, do my charting, patient reactions, where I gave the medication, what kind of medication was, all of that stuff. Okay. So now I have doctor's orders to give a different patient some insulin. So I confirm my doctor's orders. I'm going to do my 9 rights of medication. Make sure I'm drawing everything up, getting out what I need, got the same, the right dose, everything like that. Okay, I don't have on gloves at this point, but for the purposes of this video, I am not going to remove them because I will have to step away. So, giving this patient insulin, and they were ordered 10 units. I'm going to go ahead and draw this up. He had Monday and a Tuesday, and our day was crazy. So anyway, he was, there's a long stretch of road where you can see him. He was going 100. Oh no. My husband and I ski. have my lid down here. I'm going to go ahead and recap that. Okay. Now that I have my medication, I'm going to go ahead and gather whatever other supplies I'm going to need to be able to give this to the patient, enter the room, do hand hygiene, put on my gloves, explain, confirm my patient name, date of birth, allergies, do the, all of the right, 9 rights of medication, and check the patient's abdomen. That's where I'm going to be giving it, within 2 inches of the umbilicus cord. I'm not going to be injecting it in any, like where the last spots were used. So for this patient, I have the abdomen now exposed. I have my insulin here, and we're within 2 inches of the umbilicus. Patient is a smaller patient, so I'm going to use a 1-inch pinching right there of the subcutaneous fat. Okay. I'm going to go ahead and just clean that. We already have it pinched. I'm going to let that dry. Here is my 10 milliliter, or sorry, 10 units. Go ahead and pinch that in 1 inch again, and we're going to come in on this at a 45 to 90 degree angle, dependent on the patient. So on this one, here we go. All right. Dispose of this into a sharps container. Okay, there's a dot of blood. We can do that. Good. All right, so the same thing with this patient. We're going to do all the bed safety checks, dispose of my equipment, take off my gloves, hand hygiene, go back, document all the stuff I need to document. Okay. Now, for my last one, I'm just going to go ahead and get rid of this stuff real quick. Last one, I have doctor's orders to do a TB test. So for this is going to be my intradermal. And I'm going to be drawing up some TB solution or medication in here. And we are going to be given 0.1. So So we have 0.1 of our solution. I'm going to go ahead and remove this and recap this. This is ready to go. I'm going to go ahead and gather whatever other supplies I will need. In this case, I will need an alcohol pad, and here is my TB medication, or TB medication. All right, same thing, going to hand hygiene, gloves, confirm patient, date of birth and name, and allergies, 9 rights of medications. We got everything we need. We have confirmed everything is good. Okay, so on this patient, I'm going to be using the forearm of the patient's forearm, and we are going to be going in at an angle that is parallel to the skin, parallel to the arm, probably like a 5% or 5-degree angle. So in this patient, I'm going to go ahead and clean the area I'm going to use, and it's kind of hard to see, but there we go. And while that dries, I have my solution. Okay. And I am going to pull back on his forearm skin down here and bevel angled up. And gonna go ahead and go in. Alright, we have inserted it enough. Okay, we have created a wheel. I'm going to remove this, dispose of this into my sharps container. I can dot any blood on the side, but I'm not going to cover this. I'm going to let this patient know that they need to come back within 48 hours for us to look at his TB results. Okay. Same thing. I'm going to dispose of my supplies, take off my gloves and hygiene, and then, you know, go back and document everything that needs to go for that. So that is those are those 3 videos together. Okay.